Hello and welcome back. In our final video on psychological disorders, we are going to be diving into schizophrenia and dissociative identity disorder, what these two disorders look like and how we can identify them, in addition to some potential causes for these disorders as well. So let's go ahead and get started with schizophrenia. This is actually not a disorder itself, but a category of disorders. They are very severe psychological disorders that are characterized by disorganized and delusional thinking and disturbed perceptions and inappropriate emotions and actions at various points in time. The two trademark symptoms of schizophrenia are delusions and hallucinations, and it's really important to know the distinction between the two. Delusions are known as false beliefs. These beliefs could be grandiose, or they could be paranoid, such as somebody is out to get me. Hallucinations are false perceptions that we see in schizophrenia. So these are things like seeing or hearing things that are not actually present in the physical world. Auditory hallucinations are the most common, but it is possible to have other types of hallucinations as well. So what causes schizophrenia? Psychologists have been able to identify three major factors that contribute to the prevalence of schizophrenia in individuals. The first and most significantly is dopamine overactivity in the brain, in addition to other brain abnormalities in activity. That seems to be a huge contributing factor to the symptoms of schizophrenia that we see. But other causes include things like genetic factors and maternal virus in pregnancy. But schizophrenia is typically onset, meaning it develops at some point in time. So what exactly causes a person who may have the genetic predisposition for schizophrenia actually develop the symptoms later on in life? Psychologists use what's known as the Diathesis-Stress Model to explain why schizophrenia develops. It needs both the genetic predisposition, but also the psychological and environmental factors that can cause the disorder to manifest or show up. Meaning oftentimes there are key stressful events or a single stressful event that seems to cause the psychological break to cause schizophrenia to develop in an individual. There used to be subtypes of schizophrenia, and now they are all considered additional symptoms to schizophrenia. So on top of hallucinations and delusions, we might also see the prevalence or absence of other behaviors that can indicate schizophrenia as well. Positive symptoms include any type of new or additional symptom that was not in an individual prior. Negative symptoms means the lack of some type of typical behavior. Some of the symptoms that used to be considered subtypes of schizophrenia include paranoia, so preoccupation with those hallucinations or delusions. We also see disorganization and disorganized thinking, catatonia, where we see repetitive movements or parrot-like behavior of repeating phrases or repeating phrases back to a person, and negative symptoms such as immobility or sitting rigid or mute for periods of a time as well. We can also see lack of appropriate emotional responses in symptoms of schizophrenia. So you can see there are a lot of symptoms that go into this category of schizophrenia, and it will show up differently for each individual who's experiencing a diagnosis of schizophrenia. Our final category of psychological disorders that we're going to look at are dissociative disorders, specifically dissociative identity disorder. But dissociative disorders are a category of disorders where in some way personality has been separated from the individual. They are either not aware of their personality or they have lost contact with it. So dissociative identity disorder used to be known as multiple personality disorder. It is when there is the presence of two or more distinct personalities within an individual that recurrently take control of the individual's behavior. Now, the question is, why might a person develop multiple personalities? And dissociative identity disorder seems to occur as a response to stress or trauma. It is essentially the body's defense mechanism during those stressful events of this isn't happening to me, I am somebody else right now. That seems to be a possible reason for why these multiple personalities occur. The challenge with dissociative identity disorder is that it's difficult to diagnose and difficult to treat. And dissociative identity disorder and schizophrenia are often confused, but they are very, very different disorders. With schizophrenia, a person might experience seeing or hearing things, believing things that are not actually true, but they remain consistent in their personality. They are still them the entire time that this is happening. With dissociative identity disorder, you can alter or take on different personalities. You might experience amnesia during the time that a alter is in charge of those personalities, or experience out-of-body experiences. There are also dissociative disorders such as dissociative amnesia, where a person will lose contact with time and awareness of what happened for a while without actually taking on a new personality. Sometimes that is also accompanied by dissociative fugue, where a person will travel away from home during this period of dissociative amnesia. Again, this seems to happen as a result of extreme stress, anxiety, or trauma, and a person will have no memory of the event afterwards. Sometimes that amnesia will go away, and sometimes that amnesia can be permanent. It just varies from person to person. So that is the last psychological disorder that we're going to be looking at in this unit. By now we've covered mood and anxiety disorders, personality and somatoform disorders, and now schizophrenia and dissociative disorders. In our final videos, we're going to be taking a look at therapy. Now that we have looked at the symptoms of all of these different disorders, how do we go about treating them? And how do psychologists from different perspectives approach treatment differently? Thank you so much for watching, and as always, remember, be kind to your mind.